Hi, everyone. Thanks for joining us. I'm Marty Washington with the National Clearinghouse on Abuse in Later Life. Today, we are going to be talking about sustainability, planning for when the funding ends. This webinar is being brought to you by the National Elder Abuse Multidisciplinary Team Training and Technical Assistance Center. Before we get going, I want to remind you that the opinions, the comments, the content that you hear today is those of the author and don't necessarily represent the Office on Victims of Crime, who is funding this presentation today. Just a little bit of housekeeping. If you're, unless you're speaking, if you could just stay muted, that would be great. Cut down on background noise. Rename your Zoom square to the name you'd like to be referred to today. Raise your hand or put in the chat if you have a question. Because there's so much content, we're going to be dealing with all the questions at the end. If we don't get to your question, we will definitely get back to you after the webinar, but we will answer all questions. And if you have any technical assistance issues, please reach out to me at mwashington@ncall.us. And with that, I'm going to turn it over to our speaker today, Karen Yost, and she's going to introduce herself. Karen, over to you.
Thank you, Marty. Good afternoon, everyone. My name is Karen Yost. I work for JBS International, do training and technical assistance for Department of Justice, Office of Victims of Crime, and HRSA. I'm going to be presenting on a sustainability toolkit that I co-authored for our OVC grantees. But I will tell you that I learned sustainability the hard way, and so you're going to learn from my lessons learned. And it's a general discussion on sustainability. So you will, as you get into your own planning, you will tailor your planning to your programs. Next slide, please. Today, the purpose today is so you'll understand sustainability as a process. It is not an activity. It is not just develop a plan, but it is a process. And we're going to talk about important considerations in that planning process. And then I'm going to give you some tips and strategies to support your sustainability planning. Next slide, please. Again, sustainability is a capacity issue, and it's the ability to maintain your programming and your benefits over time rather than when the grant ends. Next slide, please. So let me tell you why sustainability is critical. It really is an essential element of delivery of health and human services, because without it, funds that you've used for several years will not be maximized. If your program ends, you haven't maximized your funds. Also, you have an inability to achieve those lasting benefits for children and families that you serve in your community. And you have a potential loss of trust with the community. And let me tell you, I learned that the hard way when I took over as CEO of West Virginia's largest certified comprehensive behavioral health center. They had a reputation, a great reputation for going after grant funds and starting new programs. But when the program ended, the funding ended, so did the program. And so that really hurt the center's reputation within the community. Next slide, please. So sustainability actually should start at the beginning of a project. One of the way I approach starting new projects was I had 3 criteria. Was it a need in our community? Did I have the resources, the competence, the staffing, or the access to partners who did to pull off the program? And could I sustain it? If my answer to any of those was no, I tried to find a way to get to yes. But if I could not get to yes on any of those, I didn't go after the funding, no matter how good it looked. That served me well, because programs that I started in that center, I've left there several years ago, those programs are still in operation. So I learned that the hard way. There are best practices to sustainability, and they could be integrated into your project from the beginning to the end. And we're going to talk about some of those best practices. However, regardless of where you are in your project, you can still plan and achieve sustainability. So it isn't too late to start unless you're like in the last month. But it isn't too late. You can start anywhere. You just sometimes have to catch up a little bit. And sustainability goes beyond funding. I hear from my grantees, I have grantees across the country. And when I talk to them about sustainability, they always say, well, we're going to write another grant. In which case I say, you know, you're probably not going to get another grant to do exactly what you're doing now unless you add something, or unless you add, you add another nuance to your program, or you expand your program to another location. It isn't just about funding. And in fact, in many cases, some of the processes that you put in place as a result of your project can be sustained forever without any money. If you follow the tips we're going to talk about. And understanding that sustainability really includes interdependent components that reflect the complexity of what you all are trying to do. And you have to consider those components as you do your sustainability planning. Next slide, please. So when you think about sustainability, literature has identified 8 sustainability considerations that you should discuss and incorporate into your planning. Next slide, please. And here's what they are, and we're going to talk about each one of those. Organizational capacity, environmental support, partnerships, program evaluation, program adaptation, communication, funding stability, and strategic planning. All of those are critical components of your sustainability planning. Next slide. Understanding organizational capacity. That means, do you have within your organization the support and the resources that you need to effectively manage and continue your program? Is leadership aware of your program? Are they very supportive? Does it fit with the organization's mission? How does it fit within the organizational structure? Sometimes I had a very large organization, and some of our grant programs were very small, and other parts of our organization didn't really know what they did. And so we had to balance within our decision making and our strategic planning. How does this fit with the rest of our organization? And these considerations and these questions I'm giving you really are discussion points, things for you to talk about within that consideration. Next slide, please. Do you have external and internal support? What makes your program unique? How does it fit within the needs of your community? What demands? Demand for your services is a huge sustainability benefit. And so what makes your program unique in your community that somebody in your community says, we have to have this, this has to sustain? And layered on top of that is, unless you provide consistently high quality services with competent staff who are supervised, and ongoing training, then you are in jeopardy of not having that support. Next slide, please. Environmentally, are you knowledgeable about policies and funding structures that may impact your program at the local, state levels? I work a lot with mental health, substance use disorders, children and families. And it's really important that we keep abreast of what's going on at the state level, what's going on at the federal level, that we can either benefit from or adapt our program, because it could hurt us. So you need to be aware of what's going on within your environment. And we all know within the healthcare arena, the environment is changing very, very quickly. Another consideration, do community members, meaning your stakeholders, your citizens, the families of the individuals that you serve, do they recognize the need for your program? And not just recognize it, but do they promote it? Do they go into the community and say, we have to have this service? And I will tell you, that is a critical element. It doesn't matter how good you are, how good your program is. if people don't know you're good and people don't demand your program, then the likelihood of you sustaining it to the degree that you need to may be jeopardized. Next slide, please. External climate. What about stigma? What kind of stigma do you have in your community against certain populations? I've worked a lot with mental health and substance use, and I can tell you there's a lot of stigma relative to that we have to deal with. And looking for a lot of the programs you serve are the elderly. How does your community view your elderly? How do you have to work to reduce that stigma if it's there? And here's a critical piece. Who are the influential highlighted systems or individuals within your community, within your local area, within your state organizations who recognize the value of your program and promote it to others? Let me give you an example. I did a wraparound program under a grant, wrote a grant. So, in the late 90s to develop a system of care for children and families. And as a result of that, because West Virginia led the nation in number of children out of state and out of state care, the state was paying a lot of money, and they asked me to find some way to reduce those kids from going out of state. So we wrote a system of care grant. As a result of that grant, and we included the state leadership for child welfare, we included state leadership for behavioral health, we included families had a very strong voice in the project. As a result of that, in our 10-county region, we reduced our out-of-state number from 97 children to 38 children. And because we were so successful, we saved the state $22 million in social services dollars. Now, that doesn't count Medicaid and that doesn't count education dollars. As a result of that, our system of care became statewide and got funded by the state. So we no longer had to write a grant because exactly what we did in our project became state policy. And so finding those people who have influence and those people who control resources, those individuals who control policies can be very, very important in your sustainability efforts. And then the other thing is the voice of individuals served. How do your families feel about the services you provide? Do they talk about it? We had families go to our legislature and say, this is how my family's life was changed. My children are with me. They're going to school. I've got support. I can work, and our lives are much better. That matters to people who have the resources to support your projects. And so spend a lot of time talking about this consideration, because Find Your Champions is an important piece for how you sustain your program. Next slide, please. Partnerships. I'm a strong believer in partnerships. I believe it does take a village to take care of our citizens, no matter what their ages are, and that no one program, I don't care how big an organization is, I don't care how good the program is, one program can't do it all. You can't do it all. And so finding partners who play a role, who have what I call skin in the game relative to your programs are really important. Beyond that, though, is working with partners to develop a shared vision, because a shared vision means everybody will be on board to support. And finding a way to discuss that vision. What is this vision that we have? Is it consistent? What other partners are not at the table who should be at the table, because they do have skin in the game as well? So finding those folks who are not there that should be there can be very, very important. And again, these partners, you have multiple levels of partnership. You have at the ground level, the people kind of doing the planning, the people making the services available, making sure that they get delivered the way they're supposed to. But then you have partners at the organizational level, and those are folks who control your resources. So those could be agency heads, those could be system partners. You've got APS, you've got you may have hospitals as a partner, you've got assisted living as a partner. Whoever your partners are, getting them to work together to effectively promote the services to the individuals, but also meet the needs of their children and their families. It's interesting as we get on, and I ran a geropsych unit in a hospital, and really in many cases, the people we had to serve the most were those children and their families. So how are your partners working together? Who needs to be there? Who isn't? How do you get them pulling the same way at the same time? And which partners do you have at the organizational level that can make policy and funding decisions? Two different kinds of partners. Next slide, please. Looking at your program, are you collecting data? Do you know how you're successful? What makes you successful? If I said to you, how do you know your program's a success? What would you say? How would you define success? What do you need to show that your program is successful? We all talk about data, and I'm a data person myself, but data is data. For many of the people we serve, the story behind the data, the impact of that is just as important. So look at your outcomes, look at your data. What's the most important to your key stakeholders? Because I will tell you, with my system of care grant, what was most important to my biggest partner, which was the child welfare system, was what we had to focus on. They wanted to reduce the cost of out-of-home care. They wanted kids and families, and they wanted kids and families to be successful. It was about permanence, safety, and well-being. And so we had to make sure that we were gathering data and we were creating stories, and we were using all that information that really was important to the child welfare system. And then finally, how does your program efforts align with your system outcomes? Next slide. If you don't have that, if your program isn't really where you showing the outcomes or the data or that you want it to, what are you going to do to adapt it so that it does? And in some cases, when you're talking about sustainability, at least in my case, because we did a lot of behavioral health services, it seemed like everybody was doing behavioral health services all of a sudden. And so our sustainability, we worked hard to put these processes in place. I'll use my out-of-state care, my system of care. We put a lot of processes in place designed to keep kids in the home, or if they had to go out of the home, to get them back into the home quickly. We focused very hard on developing those processes. Well, the reality was we were lucky enough to continue the funding, but in other system of care grants, those processes became embedded into the way our partners just did their everyday business. And so the program sustained anyway, even without funding, because those processes got embedded, or what we call institutionalized, into the way services were delivered. So look at those kinds of things as well, rather than duplicate, where have you got overlap, and how can you adapt your program to avoid the duplication, but in fact, to augment and strengthen the project and your programs. And then, what changes do you need to make? One of the things I hear from my grantees all the time is, what do you think you need to sustain? In every single case, they said, oh, I need to sustain my staff. I need to sustain my staff. And so we had discussions about what that looked like. And the reality is, for some of the projects, they could sustain their staff, although it would look different. They would be in a different program within the organization or something. So look to identify those changes that you need to make to adapt to what else is going on within the community and what their needs are. And can you do it? And do you want to do it? Those are important about program adaptation. Next slide, please. What other stakeholders can integrate program components into their organizational system? This is where I talked about we institutionalize these processes. For instance, one of ours was a review process. We had a child who was being referred for an out-of-state care, either by a probation officer, by a court, by a child welfare system, whoever. And so we developed a process to review that child's case to see if there was a way that we could prohibit that out-of-state placement or return quicker. Well, the child welfare system, even when our grant funding ended, the child welfare system adopted that review process. And it continues to this day. And we started ours in 1999, and it continues to this day because that process, that multidisciplinary review, which is what it was a multidisciplinary review, but the people that sat on that team were the people that could say, I'll take that child. I'll take that child. I'll take that child. And our child welfare system adopted that process, which remains in place to this day. Even after our funding ended, our benefit continued because it got institutionalized by one of our stakeholder partners. Next slide, please. And I know I'm going fast and I'm really, really sorry, but I'm trying to get through information so you can ask questions. You do have the toolkit. All this information is in the toolkit, so you can review it as your leisure. This is recorded, and so you can have that as well. So if I go through fast, please excuse me. Communication. Communication, as in everything, is critical. And by communication, I mean, how are you communicating with your stakeholders and your partners? How are you communicating with the public about your program? Again, it doesn't matter how good you are. If people don't know about it, it's not going to be important to the public. So communicating with audiences, whoever they are, your audience could be legislators. We got legislators to put line items in our state budget to support some of our programs because we communicated what we were doing. We had our families talk to them. We showed data. We showed cost savings. And as a result, we got funding through the legislature that is there. So thinking about your communication strategy is a critical piece. Think about, what do you want to accomplish through your communication strategy? What messages do you want to send to your audience? But let me qualify that with, your message has to resonate with your audience. So I listen to things that are important to me. If it isn't important to what I do in everyday business, then it's just interesting. So you have to pick your message to match your audience. It can be the same message, but how you communicate that message is different depending on your individual audience. And I always say, done a lot of work with law enforcement. And when I've done programs to work with law enforcement, my partner was always law enforcement because law enforcement spoke the language of law enforcement. And so we had to give the message to law enforcement for many of these children who were also involved in juvenile justice, to courts and law enforcement. Same kids, but the message to law enforcement and courts was different than the message to child welfare or schools. Exact same kids, we were trying to do the same thing, but how we communicated what we were trying to do and how we communicated our outcomes was different for our different partners. So match your message to your audience and use multiple strategies to reach your community. Again, communities that they don't do death by PowerPoint and they don't do death by data. Community wants, some of that's important and you need that, but community wants to hear the impact. So the stories of the impact, the story behind the data is really, really important. And when you're delivering a message, here's a tip. When you pick your information and you decide your message and you're going to communicate it, you have to use that communication to touch the head and the heart. So the head can be your data, your outcomes. This is how we're making the system better. But the heart, you communicate it through the heart. The message of the heart is just as important. So tailor your messages for the head and the heart. Next slide, please. What messages do you have that promote your program and demonstrate the effectiveness? In my system of care grant, we went before the legislature. We went before the judges. We spoke at judges' meetings. We spoke at the legislature. We were able to talk about how many children we'd served, how many families we'd served, how many kids we brought back, how many kids we prevented. Then the department came right behind us and said, this is how much money we saved. And then right behind that came our families who said, this is how our lives were saved. So thinking about different ways to use messaging to promote your programs. And sometimes you need to adapt those strategies. I've been and I have sat in presentations where people want to talk about these programs. They've got these real slick flyers. They're professionally done. They look really, really nice. They talk about where they are and they talk about all the things they do and they give data. But then when you start asking questions, they don't have it. And so sometimes you need to remember it's head and heart when you're communicating. If your communications are all head, then you need to adapt them to include the heart. If they're all about heart, then you need to adapt them to include the head, because the reality is funders want outcomes and they want data. And so if you do both, and if you couch your messages to attach both, you're going to be far more successful. Next slide, please. Now, funding. Everybody's concern is money, right? We all got to have the money. We all get really concerned because we know we've got 6 months till the end of our funding period. Then what do? Writing the next best grant may not be the best strategy. So in thinking about funding as you go along through your project period, think about future funding strategies. Do you know what they are? Do you know what's going on at the state and the national level that may impact your funding? Are you keeping abreast of that, or are you so busy doing the work every day that you neglect to know that? Well, you need to know what's going on at the state and federal level. A lot of times I'm at the federal level now, and so I can say, oh, I know there's projected funding coming out for this. When I worked in the community, that was difficult for me. I wasn't always as aggressive in maintaining my knowledge of possible future funding. So think about, how are you staying abreast of what's coming down the pike? And do you have the systems in place that allow you to get that information? And I do a lot of work with this Department of Justice, and every day I get emails, new funding opportunities. So go to grants.gov and get on their system of alerts that notifies you when new funding is coming up, because all of those report through grants.gov. So that's a good mechanism to find out about future funding. Are you aware of funding mechanisms that support similar programs within your organization? Okay. So what are they? I always tell people, we talk about Medicaid a lot because Medicaid paid for services. We talk about state funding because we get a lot of money in West Virginia to support a lot of our services. But I'll also tell people, have you thought about foundations? Because foundations pay a lot of money for many of the programs that we do. And they don't have the ties that you have to do with grant funding, you know, that awful reporting that you have to do. So think about charitable organizations and foundations. There are a lot of them. I've been very lucky in my time to be able to get quite a bit of foundation money, and some of that foundation money has, oh gosh, we've got some United Way money that I had at the center. That they've had it 30 years. Every year they get it, every year. So think about other possible funding mechanisms that may be available beyond just, you know, billing for services and state dollars. And then think about your partners. Your partners can bring resources to your table that you can leverage them. In my case, in my system of care, um, child welfare brought money to the table, and they said they were involved in everything we did. We had good outcomes. We had good support from families. They were very vocal about the services, and they brought money to the table. And then guess what? The next year, our Bureau for Behavioral Health put money in the project to serve kids who weren't involved with the child welfare system. So partners can bring resources to the table, you know, actively pursue them and try to find ways to leverage their resources to sustain particular program components. And in our case, the child welfare system adopted our review process for children, our case review process, and that is in place today. And we don't have to pay for that. We're a part of it. Many of our organizations are still part of that review process, but the state now pays for that process. Next slide, please. And then planning. When people hear the word strategic planning, everybody kind of loses their mind, because it's like, oh, one more plan. It's going to sit on a shelf somewhere, and we're not going to look at it again until it's time to review it and do a new one. And really, that isn't strategic planning. It is using those processes to guide your direction to meet your goals and develop strategies that are specific to what you're trying to achieve or what you need to achieve. In this case, all the considerations that we've been talking about, figuring out where you are in terms of, is this a strength or is this a weakness? And then developing a sustainability plan that allows you to address those considerations that really aren't as solid as they should be. So spend some time on those, and then use that plan as a working document, not just review it every now and then, but it's designed to be a living, breathing document that you continue to review. And I always tell grantees, review this at least, if you're planning a year, if you're doing strategic planning, review it at least quarterly so you can see where you are. So do you have a sustainability plan? Questions like, when did you begin it? Is there a shared vision for sustainability? Again, you've got partners who may have different ideas about what needs to be sustained. You need to have those discussions. Have you incorporated sustainability activities into your program operations? Remember, we talked about partners, we talked about organizational capacity, we talked about data, we talked about developing messages in your communication strategies. Those can all be built into your operations, your ongoing operations. And then finally, how do you know? How do you know you've been successful? So measures of success then get built into your plan as well. Next slide. So here's the process, the sustainability process. Assemble a planning team. Now, let me tell you about the planning team. The planning team needs to be people who control resources and control policy and funding decisions. So your planning team is not necessarily your on the ground case management, clinical services kinds of folks. These are more your leadership people or your influential people. So identify them and think about it. They may not be part of your project right now, but they're on the periphery of your project, so you can still include them. So assemble your team, and somebody needs to be identified to lead that. Conduct a sustainability assessment. We're going to talk about it here in just a moment. The PSAT is a good sustainability assessment. It's free. It incorporates all of the considerations. So you want to find out where you are with regard to all of those considerations. Where are we strong? Where are we not so strong? Where are we very weak? And then focus on the weak first. It's kind of like in the clinical world, a treatment plan. We focused on, sometimes you have to focus on the biggest problem first. And so conduct the assessment. That can be done a number of ways. You can send it out. You can do one section at a time. You don't have to do it all at one time. You can have different people in your community do it. You can do it as a group, all kinds of ways to do it. But don't think that you'll sit down at one time and do the whole sustainability assessment unless you're going to keep people there all day, and then they're not going to want to do it. So you can break it up into smaller pieces that allow you to get it done with not so heavy a lift. Review the findings. As with any assessment, we've got to review the findings. And based on those findings, you've got to prioritize. You got to summarize and prioritize what they tell you, because again, you may find you're strong here, you're not so strong here. Maybe we need to focus on this. Maybe we don't have good communication strategies. Maybe we've got great communication strategies, but we don't use our program evaluation to the degree that we should. Or you know, our partnerships are good, but we know there's somebody missing that needs to be included. How do you recruit them? So you have to summarize all of that assessment and then prioritize what do you need to do next. Then you develop your action plan, you implement your plan, and you monitor and update. Again, these plans are not meant to sit on a shelf. They're living and they're breathing. They can be changed at any time. I'm one of these that really likes to use a plan because I like to write completed, completed, completed. I really like when I highlight that section and say done, done, done. It's really good. And I find that my teams like that as well because they feel like they're accomplishing something. So don't just put it on a shelf. Make sure you review it. Make sure you talk about it. Make sure you say, okay, we've done this. Now we need to take what's the next step that we need to do? So use them as a guide for some of your work, not just, okay, now I've got to do a new strategic plan. Next slide, please. So prepare to assess your program. Again, define what you want to assess and be very clear and specifying what you want to be included in your grant assessment. What components do you want to be put in there? Invite internal, external, like I said, they don't have to be people that are really a critical part of your project, but it could be people who have some skin in the game. Internal parties are responsible for the success of your program, but external partners can work closely with your program and can have influence on the success of your program because they have policy and funding decision-making capabilities. So those are really important. So do a mixture of internal and external. This is also a good way to develop those champions that you may not have developed. So you want to always develop champions. You have your staff, your organizations are champions. You have the individuals you serve and their families, those can be champions. The professionals that you work with, you know, those providers can be champions, but champions can also be beyond that. So this is a really good opportunity to bring some of those folks into your project to develop them as champions. Next slide, please. Complete the assessment, identify the tool. There are all kinds of tools that you can use for sustainability. I particularly like the Program Sustainability Assessment Tool, PSAT. It addresses the 8 considerations. It has been determined to be valid and to be reliable. It isn't that hard to do. And it's free. I always like free. Free always works. So that is one of my favorites. And it's usable in a variety of programs. So it isn't just for healthcare. Governments can use it. I used it within my organization. We used it within our grant systems. It's very easy to use and it's free. I always go for free. So
Karen,
yes.
I'm sorry. Suzanne Meyer had a question about
Okay.
the PSAT.
Mhm.
She just wanted to get a bit more information. Suzanne, if you can just unmute yourself and ask a question if you have one.
Thank you. I'm choking a little bit, sorry. I just coughed. The PSAT tool does seem like a perfect way of doing this. We're toward the end of our grant cycle.
Mhm.
And I'm wondering, first of all, is this something that we can do at any time?
Yes.
And then once you have the determination of the tool, can you then, how does it advise you to use your results to potentially improve your sustainability or
the results from the tool are used for you to prioritize
Okay.
what activities you want to do.
Got it. Okay.
And then they go into your plan. And when we get a little bit farther along, I'm going to show you a plan.
Okay, great. Thank you.
But you can do it at any time. Keep in mind that there are 8 considerations that go into that. So if you are at the end of your grant period and you say, okay, we want people to fill this out, they may kind of lose their minds because it looks overwhelming. But I will tell you, you can split it up. It's one of these things that it's so flexible, you can use it in a number of ways.
Okay.
So and the information's on the bottom of the screen, but it's also in the toolkit. And there are samples of it in the toolkit as well.
Thank you very much.
You're very welcome. And then sometimes you can refine the tool to define terms that are more applicable to your organization and your project to ensure common understanding. Again, it's a general tool it's meant to be general, but it doesn't mean you can't tailor some of it to fit your program. Next slide, please. Again, like here's an example. You can go ahead, Lisa, to the next slide. This is environmental support. And remember, it's building or maintaining a supportive internal-external climate where your services are a priority of leadership members who can leverage resources. Next slide. Here's what it looks like. Here's what it looks like. Champions exist who strongly support the program. And it's a scale, a Likert scale. And so sometimes you may not be able to answer, but you can answer 1 to 7. So if you are champions exist and you're a 1, then that may be an area you want to prioritize for your sustainability planning because champions are really, really important. And so you just go down and ask, and you can see by reading the questions, they're general. I mean, they're applicable to a number of programs, but you still have some ability to define terms within there if it doesn't fit. But this is what the tool looks like for environmental considerations. And you just circle. It is not difficult. Next slide, please. Then once this goes back to pull your team back together, your planning team, review your data, make sure you've got a common vision, common mission, common purpose. I always have those kinds of meetings when I pull teams together. Think about what you want your program to look like in 3 to 5 years. Have those discussions because that's the vision piece. And many of you are familiar with these kinds of processes. Next slide, please. Review the findings. discuss opinions and perceptions about those findings. And remember, you're going to have different people filling this out. So some may say you got a 1 in a champion, and some may say you've got a 7. So talk about your results and try to figure out, where it is. I typically, when I pull my planning team back together and I've got a whole lot of data and we've looked at it, we as a planning team then figure out where we are really, because you're going to have variability. And so you look at the range of scores and then say, okay, this is where, based on this, we really think we are. But it's really good conversation. Next slide, please. Then determine what you want to sustain. And the reality is you may not be able to sustain everything. That just kind of is. So figure out what you have to sustain, what you want to sustain, and then figure out what may not be sustainable. So identify what you have to, what you want to, and then what else is there. What components have to be sustained? Are there opportunities to integrate these into other programs within your organization? And you all are an MDT, so you've got differing, but how can you integrate those components? In my case, with our wraparound and our system of care grant, our behavioral health system and our child welfare system integrated that review process into both of their systems. It was sustained at the state level. So there may be another program in your organization or a partner organization that can sustain that because they have funding, to have resources. Are there better financing sustainability options if another organization does adopt it? In our case, yes, there were, because our child welfare system adopted it, our behavioral health system adopted it, and that worked out well because we know it was sustained. It was not only sustained, but it was expanded to statewide. And that was perfectly okay. We didn't get to keep our wraparound facilitators, that's what we called them, necessarily, but they were absorbed into other parts of our programs, and they were still doing wraparound within other organizations. Next slide, please. Prioritize the areas. You've got to develop an action plan. Prioritize your capacity areas. Look at the strengths and challenges from your assessment. Find low-hanging fruit and find those large payoffs with the least amount of resources. Where can you make the greatest gains? Which domains are the most important? Look at your evaluation data to determine which ones are the strongest. We had programs that had great outcomes, but they only served 4 or 5 people. They probably didn't stack up against programs who had maybe not quite as good outcomes, but served a whole lot more people. And so we had a larger payoff in that, but you have to make those decisions. But let me tell you, this step is not always easy because everybody wants to sustain what they want to sustain. And so sometimes you have to have give and take. This process, you'll have to go through this process, take the time. And this is where everybody kind of has to leave their egos at the door, because every organization wants what every organization wants. And I don't want to give something away and you get it and I lose it, but you get it. The reality is, when you're really prioritizing your areas to sustain, that really is what happens. So this can be a tough step, but it is a critical step. Next slide, please. Write your plan. Write them down there. I'm going to give you on the back of this. There's one, and there's one in the toolkit. There's a sample action plan. Each one needs to have someone identifiable who's going to be responsible. You need a time frame. It's that whole kind of SMART objective thing, specific, measurable, achievable, realistic, and timely. List resources and stakeholders required, and outline measures for tracking process. It's a plan. You all I know are familiar with writing plans. Next step, please. Here's a sample format. Vision statement, background, current funding sources, results of your assessment, program elements you want to sustain, who are your partners going to be, and what is your time frame. So this is the beginning of your plan. Next slide, please. And I know you can't see this because some of it's blue, but darker blue, but this is a sample template. And it is in the toolkit as well. So, you know, what steps are going to achieve, what's your objective, what steps do you need to do, who's going to do the work, how you know you were successful, what resources are needed, and then what due dates. And you can see these are done by quarter. Again, I said, oh, we'd like to track by quarter. And then you just go in and complete it. Next slide, please. And implement your plan. Use it as a guide, periodic updates, continually address challenges, monitor your progress. If you pay attention to the plan, you will accomplish a lot more than you think you will. Next slide, please. Adjust your plan as needed. You know, again, you know, here I always did sustainability. I started at the beginning, and so I did it at least updated annually, but you can update it anytime. It's really that flexible. And adjust it to address new challenges and opportunities. Over time, your environment changes. And so sometimes you have to go back and say, okay, here's a new twist, and adapt. Next slide, please. Remember, sustainability success depends on starting early, following an established process, including partners and stakeholders, and developing, monitoring, and updating a plan. Next slide. Look there. We got a couple of minutes for questions. Any questions? And there's the citations.
Karen, I just want to mention that in the chat, I put the link for the follow-up survey. If you could fill out and give us some feedback, that would be great. The link is there, and it will also be in my follow-up email. Also, on May 29th at 1:30 is the first roundtable of the 3 roundtable series. And so if you could join us on that day, that would be great. And I
will certainly look at my schedule, and if it is possible, I know I have to take a trip sometime around that time, but I'm not sure yet the dates, but if it is possible, I would love to join.
Okay. And I believe, Kylin, that you'll be sending out information on how everyone registers for that, right?
Correct. Thank you, Marty.
Yeah. I don't see any questions in the chat. Does anyone have a question you want to come off mute and ask the question directly?
I know I went fast.
And as Kylin mentioned in the chat, we will be sending out the slides, so they'll have those.
And remember that as you begin working your roundtables, the information I've given you is general sustainability. But when you start your work through the roundtables, you will make it much more specific to the E-MDTs. So the questions and all are general, and they're applicable, but the conversations will be geared specifically to your work.
Karen, I'll ask a question. We had one grantee from the first class who passed the MDT program on to another community partner for them to take that over and to continue it. Have you seen success
Yes.
from that perspective in terms of 2 partners that were involved being able to hand it off?
Absolutely, because they were partners from the get-go, and the project grant funding is leverage funding. And so the funding, I've seen that successful many times, was really used to leverage to develop the process, you know, and then again with our child review teams. That got passed off to the department. They did it extremely well. Now, we were still partners because I was a big service provider. And so many of the partners stayed the same, but the process itself went to the child welfare, and they did a really good job of it. They did a really good job of it. Absolutely. That's why you have your partners involved.
Mhm.
Any other questions?
One of the things we've talked about around programmatic sustainability and institutionalizing the work is how you pick between E-MDT members being the person who gets along with the team the best, or do you put it in the job description of a specific role, and how does that play out?
I think it could look different for different teams. I think I always am one for, well, depending on the team, if it's was my organization, not my organization anymore, because I'm out of I don't do direct services anymore, but within my organization, if it's our responsibility for a team, I put it in their job description. But that doesn't necessarily have to be that way. And the reason I did that is because when I evaluated performance at the end of the year and when we came to raises, I wanted to make sure that was incorporated.
Mhm.
I also wanted to, I mean, job descriptions are, tie people, you tie the can to somebody's tail. So I did it for those reasons, but every team is different. Every community is different. And part of this process, what makes this process so good is its flexibility to be adapted to whatever the community is. So the answer to that would be, it depends. That's a long answer to it depends.
We have a couple minutes left for any other questions.
Look here, we're done in an hour. Yes. Well, I appreciate being invited to speak to you about sustainability. I like sustainability. I like talking about and I talk about sustainability a lot. I do sustainability presentations way more than I ever thought I would, thanks to Stacy Phillips. But I did learn the hard way. Many of my lessons I learned from others' experience or from my experience. And I like to share that with people, to say that this is not, it isn't really complicated. There are a lot of steps to it, but it isn't an activity, it's a process. But it's really, really important to sustain all the work that's done. I mean, a lot of times this is federal funding supporting these projects. And the purpose of that is to identify these really good services, these really good programs, these really good processes. And I hate for that to just die, when the funding dies. And so I really like to talk about sustainability and try to help my grantees incorporate sustainability into their projects at whatever stage in their project. It's never too late to talk about it. But if you're at the end of your project, you either got to rush and do, or you take parts of it. And that's a good thing about the PSAT too. You can take parts of it and do. But the process is really important when you're thinking about sustainability. Not an activity, just sit down and write a plan. You got to have some foundation to write that plan. And that's why sustainability as a process is important.
Thank you so much, Karen.
You're welcome.
And with that, thank you so much for all of you for joining us today.
Okay.
I wanted to say thank you so much for this fantastic presentation. I think that we forget about the sustainability portion, I think, for most things in life. And it's so important to have a plan in action. Plan is love. If we want to continue these amazing efforts in the community, we have to plan now for the future and also solidify those relationships, because like really we're kind of salespeople. It's like people knowing about our program to want to support us. So I really appreciate having an outline on how to kind of get there, because, you know, we all can think about sustainability, but having someone that has done it and walked the walk makes it a lot easier. So thank you.
I agree, Catherine, and you're very welcome. We are salesmen. I mean, we're selling our services and we're selling our programs, and the way you go about that, you know, it is important. And the sustainability plan is designed to kind of help be guidance in that area, figure out where you're strong, figure out where you're not so strong, and make it stronger. I mean, it's really important. And the toolkit, I mean, you can follow the toolkit. I mean, it is not rocket science. You truly can follow it.
I love it. We don't need to reinvent the wheel. Let's
No, you
use
don't.
what's working.
I believe in working smarter, not harder.
Absolutely. So thank you.
You're very welcome. Thank you all, and I hope you have a great day.
Thank you.
Bye.